Truck 1, Ambulance 1, Medic 1, showing all units en route to
Dispatch ambulance 7, St. Mary's code 3 was on.
Today, Going Interior, a podcast about doing hard jobs and living life well. This podcast is designed as a collaborative tool so we can learn from one another and share ideas on finding joy and meaning in our work. I'm your host, Jamie Cavanaugh, and my guest today is Jami Lloyd, our therapist for the peer support team at Grand Junction Fire Department. Jami, you've been a therapist for 18 years, working with the fire department for the last 8, and I know a number of other agencies as well now. Looks like you have lots of good habits on your time off to get outdoors, work out, that sort of thing, spend time with your 3 kids and your husband. Welcome. Thanks for being here.
Yeah, thanks for having me.
Absolutely. What's your job right now?
That's a good question. I do a lot of different things and wear a lot of different hats, working with so many different agencies, but I have a private practice, so I kind of spend my days seeing clients from one of the different numerous agencies that I work with, mostly first responders, and then I spend time kind of doing whatever is needed, whether it be doing some office hours at the police department or the sheriff's office, or any kind of critical incident debriefings that need to be happening, or just training with my peer support groups, usually.
I know for us, it's amazing to have such great access to you. So part of the allure of having a therapist who's basically part of our team is that we can contact you, get in within the next couple days, which is kind of unheard of around here and probably more generally in America, to actually sit down with a therapist that you know within the week is unheard of.
Yeah, I think it definitely is one of the benefits of having a specialized person within your agency. One, there's that trust factor. I try to spend a lot of time in the agencies I work with, whether it's just walking around talking to people, doing office hours. We do wellness checks where we meet with, most people in each agency to just check on them once a year. So they all get to know you. There's that trust factor, but you're right. When someone needs to get in, they need to get in quickly. And there's all those horror stories of, someone being in crisis and calling and I can't get in for 6 weeks, and that's absolutely not how we want to take care of our first responders. So we try really hard. I do my best. I do get booked up sometimes, but do my very best to get people in, especially if they're in crisis.
You talked about the trust that you've built with the folks. I think that's been huge for a bit of a cultural transformation for us, and probably with your other agencies, first responders, police and fire departments, it's kind of a stoic culture, and I think in the past we've dealt with this stuff on our own and not really shared it, or by potentially doing a host of other activities, working out, but drinking, going out for beers afterward, doing activities together, some of which may have been healthy, getting together with your crew, that sort of thing, but not necessarily having access to this. And if we did access it, probably not admitting it or talking about it.
Yeah. I think it's one of the things that we work so hard is, one, to make things accessible, take all the barriers away from accessing any kind of therapy or treatment. But absolutely, it was one of the first things I learned when I started working with first responders, was that the trust has to be there. They have to see you, they have to know who you are, they have to know who they're calling when they're scheduling an appointment, because that's the hardest thing to do. Scheduling that first appointment is really, really difficult for people. And so when they have seen you around and they've talked to you for their wellness check and they see that you're just a normal person, and it makes it so much easier for them to reach out when they might be needing something, because they've sat and talked to you before, they've seen you in the hallway, or you've just chatted and said hi. So, that trust factor of just being there year to year, and them knowing, that you're going to be there if they need something. It's not going to be a random person standing in for you or someone different. It makes all the difference in the world, because I'll be honest, it's a hard population to get in with. Like, you guys are not easy people to trust. And so kind of spending the time and effort to make sure that they know that I'm here for them and that I'm not going anywhere, and that, this is my calling too, is just to help first responders. So absolutely makes a difference.
I think your background lends itself to to having some similarities to what we do as well, right?
Sure, yeah. When I first came out of grad school, I started working at Child Protection Services as a therapist. First starting, working with families and adolescents, and then slowly developing into working with all ages of kids that were abused and neglected. And as you can imagine, that's a rough field, and you see a lot of really horrible things with child abuse and neglect. And I went through my own vicarious trauma stuff for sure. A lot of trauma exposure, a lot of really hard, childhood abuse stuff that I saw and witnessed firsthand and dealt with. And it takes a toll on you. And I had to learn my own resiliency, and I had to understand for myself, a mental health professional, that this stuff can get to anyone. If you don't take care of it, it definitely builds up. And I had some situations where I had some unresolved trauma from my experience working at Child Protection Services. And I'm very honest when I talk to people. I use those examples of how things affected me with my time working there, and how I got better, and how you kind of learn how to face this stuff instead of compartmentalize and push it away. It makes such a huge difference, especially if you're going to have the resiliency to work in a field of trauma for a long time.
Are there any particulars that stuck with you?
Absolutely. Probably the example I use the most is just working in infant fatality while I was pregnant with my son, and thinking I was fine. It was a particularly horrific one, and a year later, that trauma coming full back to me when my son was the same age as that baby that died, and a lot of just every time I would rock him, I would just see that baby and how that baby died, and it was almost like I was seeing my son die the same way, and it was just kept happening, this intrusive vision, and I had to get help for that, and that was a year later. And it's just the nature of trauma. It's weird in how it works sometimes. It's not always right away that things start to affect you, and for me it was just that breakthrough of my son being the same age as the baby that died that brought all of it right back to me and just exposed me to that injury. I had to get some help for that. And I've heard a lot of similar stories from first responders, working with kids and then dealing with their own kids and having those kinds of same intrusive thoughts or flashbacks.
How did you deal with that? What did that look like for you getting help? You are a therapist, right?
Yeah, exactly. Well, therapists need therapists, and I still to this day lean on my therapist friends for a lot of stuff. But absolutely, I needed to kind of process that and work through it, so that it didn't get stuck. There's some definitely some things, and back then I didn't really know about the tool of EMDR, which I do now, and now I'm EMDR certified. Had I known about that or had a therapist that was trained in that, I would have definitely done it back then. But back then I kind of just did cognitive behavioral trauma therapy to kind of work through that exposure and desensitize it for myself so that it didn't continue just to resonate or be stuck with me.
Tell me about those two. Cognitive behavioral therapy, you mentioned,
Sure.
so that's traditional talk therapy, right?
Yeah, so cognitive behavioral therapy is a modality that I think most therapists that I know use at least a little bit, if not primarily. It's kind of the notion that, how we think about things, how we perceive things is a lot of how we feel and how we act. And so we really focus on the things that we can control, which is our perception of the events that take place around us. We can't always control our environment, but we can control how we perceive it and what we do with it. And so it's kind of that notion. And then EMDR stands for eye movement desensitization and reprocessing. It's a very specific modality to work with trauma and to desensitize that and reprocess it so it's not stuck with people, which I've done EMDR as well.
You mentioned the trauma not getting stuck. What does that look like if that were to happen?
That's the thing with trauma, is sometimes it just doesn't process and go into our formal memory storage like normal memories because of the emotional component that kind of it makes it kind of gets stuck and it's unresolved there. So then it really triggers us like frequently after that. And that's what was happening to me. It just needs a little help to kind of like open up that neural network and process the feelings that are associated with that exposure, so that it can just become a memory and not a feeling, right? So you never lose the memory, and even with EMDR, it's not like you're not going to remember what happened, but the feeling associated with the memory gets desensitized, and that's the key, so that it doesn't continue to cause problems or symptoms.
The feeling and emotions,
Yeah,
and
the
so the
emotions.
physiological reaction, all those things, right?
And
the
the
anxiety
neurological
reaction,
response, all of that.
What might stress look like for a first responder that's not resolving these issues, whose cup overfloweth, I guess, with issues that they've never dealt with?
The main thing when people come in, what I hear them say is, I don't know really what's going on, but something seems wrong. Like my ability to deal with things is so limited. Like I'm feeling very frustrated. My tolerance is down, and I'm just being really emotionally reactive. Like things are, especially like with anger or frustration, I'm getting frustrated easily with my kids or my spouse. Or the other side of that coin that I see very frequently is I'm just feeling numb or shut down. Like I'm not feeling anything. I'm not feeling joy and all the good things. Obviously that doesn't feel fulfilling in life. So when you start feeling really shut down emotionally, obviously that can lead to some depression. Feeling disconnected, obviously it's very hard on relationships too. So you start to see a lot of relationship problems with that too. Those are the two symptoms that I see most frequently. Some of the other things that we look out for in people, and you know, Jami, as we train our peer supporters, is just like looking for someone who might be pulling away and isolating too. Shutting down, not hanging out with friends, not doing the things that they used to be, not being as social at the station, you know, just kind of shutting themselves off and pulling away. That's another symptom that I would see if someone's really struggling too.
It's interesting that it can look almost totally different depending on somebody's disposition, I guess, all these different factors, right? So it could be they're angry and short, or they're like completely detached.
Yeah. Or anxious too. I mean, people that tend to be prone to anxiety will tend to show up as like, you know, feeling a lot more anxious, maybe having some panic attacks. Sometimes it can look like that too. So underlying root causes sometimes can just show up in terms of whatever you're prone to naturally.
I shouldn't forget that one. I think that's my go-to, is feeling anxious. And I can remember that feeling, my own struggles. 2008-ish, had hard calls, was, you know, not using good coping mechanisms, that sort of thing. Afterward, drinking too much, and I got anxious for sure and felt that, you know, stress in my chest, stuff like that. Wanted to stay busy all the time. That was kind of my way of dealing with it, because otherwise that anxiety would sneak in. But I've heard of other people who basically don't want to do anything. You know, I wanted to stay busy with, like, everything. For me, it was everything, and sometimes even like drawn to more dangerous things that took my focus there instead of to other places. I
would say that that's very common. I hear that very frequently, staying really busy, not having any downtime to really think, you know, just kind of like keeping yourself diverted with other topics and energies, you know, having a lot of sports or activities that are really risky, risk-taking, just to kind of feel that adrenaline dump. When your neurological system gets triggered so often, like first responders, because what you do is going to trigger that neurological system, sometimes what you find is that people really struggle to be able to relax and sit down too. It's not like you're consciously avoiding any kind of thoughts or anything. It's just that your neurological system just keeps wanting to like ramp up, and so it feels uncomfortable almost. And so what we have to do in that situation is kind of like help people learn how to relax again, and to get their neurological system to kind of rebalance or reset and be able to just sit without any kind of stimulation, which can be hard because you guys are busy and you run a lot of calls, and you think about it, your neurological system is just being triggered and then triggered again and then triggered. Every time those tones go off, you have a neurological response. So your body's dumping that, cortisol and adrenaline pretty frequently. Pretty soon your system just kind of resets its baseline a little bit higher, a little bit higher, a little bit higher, and then pretty soon you find yourself not able to relax. And that can lead to what I call neural burnout, where you just kind of like get frazzled and burnt out and everything kind of stops working and nothing feels right. So we have to kind of reset that too and heal that neurological system to be able to like reset. And whether that's, taking a walk, in nature, or if it's meditating or just doing some quiet time, whatever that might be, like just allowing your system that like time to kind of reset at a lower level. I talk to my peer supporters and do a lot of training that after every call, especially one that has like that, a lot of adrenaline, doing some breathing techniques and some progressive muscle relaxation after the call to kind of try to reset so that you don't constantly just keep running, in full mode the whole shift. Like just trying when you can, when you get a minute, just to settle down and get that neurological system back down to baseline with some breathing techniques or something like that.
You mentioned that getting keyed up. Since we've been doing this peer support team, I've had a number of conversations with folks, and they'll talk about the red light from the smoke detector or something like that. In our station, we have a sequence of red lights followed by, increasing tones at station 2 that might go off, once an hour, if not more. And they'll react to that even if they're at home or in the grocery store or something like that. They'll wake up and see that, the red light that blinks on the smoke detector.
That's a trigger. It's just like,
and they startle, which is going back into that kind of fight or flight, getting you amped up for the call, because we need to be engaged for the call too. So we don't want to go through the call half asleep, that sort of thing.
Sure, your body is just trained to react like that, to react. And you need to do that for your job, but that can be triggered at any time too. When I worked for Child Protection Services, I would cover the Child Protection Hotline sometimes. So we would take the phone at night, and that call had a specific ringtone. And I remember after I left that job, like hearing that ringtone, and I just had a physical reaction to that ringtone for a long time, just because of that. I can't even imagine like what it's like for you guys with the tones and that reaction time and that like neurological response that you have that's going to trigger that. And then you're out in the community one day and you see something similar and your body just responds. It's kind of like a trauma response too. It's a trigger, and then your neurological system just responds. It's not like you're rationally deciding to do that. It's just a neurological response that you can't control.
That reaction for me at this point and in my past has looked like keyed up. For some people that might look like just totally apathetic. Some people might say, I don't even get excited to go on calls anymore. Like it's not even a thing. But that's potentially not great either.
It is. So when I hear people talk about not having any kind of reactionary, and not just neurological reaction, but emotional reaction, a neurological reaction just means they're completely desensitized. Emotional reaction to things too. We've had historically a culture of not dealing with things. And so when you don't deal with things, your only other option is to compartmentalize and detach, right? And so culturally in the fire service, that was the way that we did it. And that's what was taught. And so what happens when you do that, your body just starts to do that automatically. It responds, and it's like, oh, this is what we do when there's an emotional component to this call. We just detach and compartmentalize. And over time, that's where we start to see some of the bigger problematic things of the complex vicarious trauma build, is that stuff is compartmentalized and it's not dealt with at the time. So it gets bigger and bigger and bigger. And what we see from that is most frequently is that emotional detachment, that numbness, that shutting down, that not feeling anything, inability to connect with your spouse or your kids, your friends, like just that emotional detachment. So it's really, really hard on someone's personal life. Now, it may function well for you at work, but it's not going to be great for having an amazing and fulfilling home life, and especially in your relationships is where it's going to be the most detrimental. But it also doesn't feel rewarding, because pretty soon what happens is your job starts feeling unrewarding too, because you're emotionally shutting down. We don't get the choice of just shutting down the harder, difficult feelings and still being able to feel all of our amazing, wonderful feelings. It's pretty much all or nothing. When you learn to emotionally detach, your brain is just going to start doing that pretty automatically, and then all of a sudden you start just feeling numb overall. And that's, I would say, one of the things that I see pretty frequently with people. And it's not like we can't resolve that. It takes some time and some effort to go and turn into all that stuff that's been compartmentalized and bring it back up through and deal with it so that you can be emotionally invested in life again. It takes some time, but we can heal that. But our goal is to be preventative and to not let that happen. And I think especially what we've done here at the fire department over the last 8 years, is really teach people a healthier way that will allow them to both be amazing at their job and not let this trauma overtake them, but also to still be able to be emotionally invested in their lives at home.
So what I'm hearing as a captain, I might go on a 2-alarm fire and my voice is totally steady. It's all good. This is, it's just Tuesday. That's fine. But and that is where I want to be. I don't want to be freaking out on calls, but I also am potentially developing this maladaptive coping behavior where then I go home and I got a kid. There's my wife. Don't feel like biking, skiing, any of that stuff. And everything's just a shade of gray at that point, right?
The ones that I think tend to really stick with people, and the ones where we emotionally detach, are the calls that have that emotional component, where there's family members that have just lost a loved one, right? Or a really egregious child abuse case, or domestic violence where it's just horrific with those moral injuries, right? And those are the ones where, and you're right, Jamie, when you guys are on scene, you have to compartmentalize, right? That's your job. You have to be focused and rational and make decisions, and that's absolutely right. But what I try to teach people is that after the call is time to face that emotional component of that call. And not every call is going to have an emotional component. In fact, it's not even frequent, but they are there. And those are the ones that are going to be harmful if you don't turn and face them afterwards. Now that might look like a diffusing with the team after everything's said and done, and you get back to the station, or you're back in the ambulance, or you're on the truck, talking about it. And just, if you're having an emotion in that moment, instead of stuffing it and feeling like I can't let that out right now, letting that out. Maybe you don't have the luxury on that set because you had to go right to another call. So maybe it's after you get off shift and you just take some time and you process that feeling after shift. You don't leave it in that compartment and just be like, I'm never going to think about that again. I'm going to move on. You take the time, you stop, you pull that call back out, and you process through it. If you feel like you did a good job of that and it's still sticking with you and there's some more significant symptoms going on, then it might take talking to a peer support member or coming in for a therapy session and doing some EMDR. But for the most part, the key is just knowing when it's one of those calls that needs to be processed, and then taking the time to do that when you have the time. And that's what changing the culture does, right? Is that now people don't feel like they have to shove that down after a call. Their captain is checking in with them, or even having their own emotions, right? It's just a lot more acceptable now to process a really, really hard call like that, no matter what it looks like for you and you're processing, whether it's crying, whether it's being angry. You guys are human, and we're made as humans to have reactions to these things that we see. Your ability to be able to process the emotions of those difficult calls is just vital to not only having a long career in the fire service or law enforcement, but also to having a healthy home life and being able to maintain, healthy long-term relationships and hobbies and, the stuff that we all live for, right? The stuff that makes life worth living is, being able to have a fulfilling life.
the other one that comes to mind, we both just read What Happened to You, this book about trauma, and one thing they say is that that can be overcome in little ways. It's not always the hour with the therapist, right? It might be the 5 minutes on the bumper with your partner, or driving back in the ambulance or the truck, just like, man, that was messed up. And not diminishing it. Sometimes we use humor to, to help ease our minds a little bit.
Yeah.
That's a thing, and that's probably healthy and fine. And at some point, reckoning with that, connecting with folks, even in those little ways, can potentially be a good thing and part of a more robust healing process, right?
Absolutely. Yeah, you're right. And sometimes just really even understanding what a trigger is and why, and like that you felt something, and was it this call or was it something else that it's triggering from the past, right? Is that something from something else that's triggering for me in my childhood, or, whatever, we all have histories, and in that history everybody has what we call small trauma triggers from just emotional stuff we've been through. It doesn't have to be some major traumatic experience to be triggered. You can be triggered by almost anything, but we're triggered in both positive and negative ways. They're just triggers. And understanding what that is and then being able to recognize it is that small thing that you're talking about, is just sometimes recognizing like, oh, that comes from that. Like, it's okay that I'm having this feeling. I know what it is. Yeah.
So in our ideal world, let's set up some of this. We're building resilience even before we're going on these bad calls, right? We're saying this is a challenging job that we do. It's filled with hard things, and we're also going to live life, which is full of hard things as well. None of us get out unscathed, right?
Yeah.
How do we develop resilience beforehand, and then we'll get into like kind of afterward? But what are some good things that we would tell people, like, develop these habits, right? We talk about power of habit and stuff like that,
I just
right?
mentioned two of my books that I always recommend, Power of Habit and that recent one we just read. But absolutely, like good mental health, right? Good mental health leads to resiliency. So it is about all the things. It's about self-care. It's about, doing the things that make you feel better, which is working out for a lot of people, which is one of the best ones I use personally, like to deal with any kind of like emotional hardship, is a good workout, right? Talking to people. Whatever works for you that keeps you healthy, and then prioritizing that. I think that's the key that a lot of people don't do, is they don't prioritize themselves or taking care of themselves.
Until it's a problem,
right? Yeah. As mental health professionals, I feel like it's something that I have to beat into my clients is you got to prioritize taking care of yourself. Otherwise, you're going to burn out no matter what. And because like you were saying, Jami, we're going to face hard things, both at work, especially for first responders, but also in our personal life. We're all going to go through difficult things. We're going to lose people in our lives. We're going to face, health problems or whatever that might look like. And mental health and prioritizing yourself and good mental wellness is really key. You don't wait till it's a problem. It's about being preventative, which means forming good mental health habits. That means not turning to alcohol, to deal with your stress. It means, having good communication skills with your family members and making sure that you're prioritizing your hobbies and passions and not leaving those in the dust because you're exhausted from work. That's a really bad habit to get into, and we know that first responders tend to do that sometimes. Is work is so adrenaline driven, and it's so, we talked about the neurological response, that oftentimes it's so easy to go home and just crash, right? And then we don't go do the things that refill our cup, like, going for that long bike ride or getting out for a hike or going and being social with our family or friends. We don't do that because we're just kind of exhausted. But then you get in that cycle of going to work, and work establishes and gets all of your mental and emotional energy, and then home is for nothing but recuperating and resting. And we can't have that cycle either, because home should be for filling your cup up. That means doing the things that you really love to do and connecting with the people that you really love to connect with, so that you can have enough emotional energy to invest at work.
Yeah, you're reminding me of that training we just attended. Dr. Gil Martin spoke about Emotional Survival is his book for law enforcement or first responders.
Absolutely.
But he talks about having those different pots of where you put your energy. So family, work, spirituality, hobbies, exercise, all those different things go into creating a robust life and becoming resilient. And it's good we need to put time and energy into each one. I try not to solely do work.
Yeah.
And consequently, I still like my job.
Yeah, it's work-life balance, right? Yeah, I think it's one of the things that I talk to recruits a lot, or someone that's new into the fire service or law enforcement is, you're right, they absolutely love it. That's why they got in this field, and it can be so exciting and so, like, you're right, they want to be here all the time, like, invest everything into it. And so it's almost like having to pull them back a little bit and say, I understand that is your complete passion right now, but if you can develop good habits of balance right now, you'll appreciate it later, right? Because it is exciting and it is fulfilling, and you love the work that you do. But that's also that pitfall that I was talking about earlier about letting it become your identity. You have to really almost work against letting it become your full identity and still make sure you're investing in those other parts of yourself. And as great and as amazing as this is, if you want to do it long term, you have to balance that out, especially in the beginning when it's really fun and exciting to do these things. I mean, I feel really proud of the work that we've been able to do here at Grand Junction Fire Department, because I feel like we've been able to transition from that being reactive to people burning out and having struggle to really working the prevention phase of like, okay, we are on the forefront of this and we're teaching people good strategies of how to deal with trauma and burnout and compassion fatigue and moral injury. We're training on these things, we're teaching it, and we're being on the forefront and preventative versus reactionary, which is so good to see. And it takes a lot, Jami, you've been here from the beginning of peer support, that it takes a lot of hours in the beginning, a lot of skin in the game, a lot of work to get things going in an agency, but it's so worth it when you start to see the cultural shift that we have been able to see. And I frankly have been able to see in all the agencies I work with after a few years, like that cultural shift of people being open about talking to, about coming to therapy, or, understanding peer support and utilizing it more frequently and trusting it, like all of those things. Like you start to see the results of all that, of that hard work of having programs like that and resources to take care of people. That's why I'm so passionate about it, is because you guys take care of all of us. Like, we should be taking care of our first responders.
So I do want to draw a little bit of a distinction, though, between quiet quitting is like a thing right now, right?
Yeah.
So, but to me, that's almost another branch of burnout. These people are saying, like, my work isn't important at all, and so I'm going to focus all my resources in these other areas of my life, right? That's not, I don't feel like that's what we're saying. We're saying this job is important. It's good to be passionate and temper it with making sure it's balanced. You're taking care of yourself, taking care of your family, taking care of your team at work, all those things, and not overdoing it.
100%. I think it's the opposite of quiet quitting when we talk about what we're trying to keep people is emotionally invested in their job, because that's where fulfillment comes from. Like, you didn't get into the job of being a first responder because you don't care about people. It's the opposite. And when you start having what we call compassion fatigue, because you're starting to burn out, that your fulfillment from your job gets lower and lower and lower, and that's where you start to see people struggle with burnout because they're not feeling fulfilled in their job anymore. So it really is the opposite of that. We're trying to keep people emotionally invested, but also through balance, right? Like, being happy and fulfilled at home is going to make you way more able to focus and be happy and fulfilled at work.
Tell me about compassion fatigue. You mentioned it. I've worked on an ambulance for a lot of years, and I think that can be a thing. It's one way of framing this, right? If people are running on similar patients, low acuity calls, stuff like that, they're getting woken up frequently, so we're not as we're not as resilient when we're tired, we're overworked, all those things. This is a term to kind of describe that syndrome, right? Or constellation of symptoms.
It's when you're not feeling connected and fulfilled with like patient care anymore, right? Like you're just feeling like emotionally shut down and you're just going through the motions. Like that isn't going to make your job feel fulfilling. I think anybody in a helping profession has struggled with compassion fatigue at times in their career. It's kind of feeling overwhelmed with the emotional response or like getting burnt out with that. So you kind of do the opposite in that shutdown. It can happen more easily when you don't have good coping mechanisms to deal with like when you have big emotional calls, and so you just start shutting down. But it can also be just that not feeling like you're making a difference. And that's what you were talking about, like feeling like, okay, like, am I making a difference anymore? It's not feeling rewarding. I'm not connecting with my patients. But there's a lot of different reasons and things that can lead to compassion fatigue. But I think that just understanding that it is something that most people are going to experience if you're in a helping profession is at some point you start to feel a little bit of compassion fatigue. And that's just a sign that, okay, I need to stop and figure out what's going on with me. Why am I not feeling connected out at my job? Why am I not connecting with my patients as much as I used to? Why am I shutting down? And just figuring out where it's coming from, because like I said, it can come from a lot of different things. It's a component of burnout. It can be a component of vicarious or complex trauma. It can be a lot of things. It can be that you're overwhelmed and emotionally shut down and going through stuff at home. It can be a lot of different things. I think the thing is just recognizing that it's a pretty big symptom that we don't want to ignore, because one, you won't stop getting that rewarding part of your job, and we don't want that. And we don't want people just going through the motions, because you won't be able to be your best responder if you're emotionally shut down and not connecting at all.
Yeah, it seems like there's a couple feedback loops going on in some ways. You're talking about this compassion fatigue where people are shutting down, not as engaged. If you're not as engaged, you're not getting the rewards from your work, your patients aren't connecting with you, you're not feeling like you're making a difference, and it's kind of this
cycle,
sort of
right?
a spiral. Another thing from that book we read was just the that level of engagement. I think it just creates almost with this reciprocity with somebody, right? So you can generate that by being engaged in the conversation, that sort of thing, and that amplifies it and brings it to a different level. So a lot of the people we interview on this podcast, like kind of at this point in their career, I'll say it that way, they're exemplifying those things, and not to say that they won't struggle, or more throughout their careers they have. So they engage with the people they're working with their patients, with the people they encounter on emergency scenes, all those things. And it's like this generative thing that like creates something really cool, but if they weren't doing that, they would get the same response mostly from the people they're encountering, from their patients, that sort of thing.
You're absolutely
not that
correct.
fulfilling.
Like sometimes it just takes that little perspective shift to be able to engage with that patient and connect again. Like it just takes, and that's that cognitive behavioral therapy we were talking about in the beginning, is just a little bit of a perspective shift. Sometimes it's just enough to re-engage, but to recognize when it's starting to become a problem is the first step, and then we can work towards like, how do we resolve this, and to understand that it is absolutely kind of a normal phase. Even though it is something we want to address, it's normal that it happens to people in helping professions.
Tell me about doing the work. So there's this concept of like a moment of enlightenment or satori that's like, my mindset shifted like that.
Yeah,
which
aha
in my
moments.
experience like never happens.
Yeah.
But there could be, like you said, a recognition that I need to shift my mindset. But how do I get there? What is the actual work? I go to therapy. Is there homework? Are there things people can do daily to help sculpt that mindset?
Well, it's funny that you say that, Jamie, because when people come into therapy, it's like, okay, I'm here, like fix me. Like, let's just do an hour and let's call it good.
Medically, it's like, I want to take a pill and then I'm all good. Basically, how do we do that work? We can't just all of a sudden hope that our mindset is going to shift. That's generally not what's
Yeah.
going to happen. We
Although
need to,
sometimes people do have those aha moments, right? And usually it's just an enlightening or a recognition of something, that aha moment that they talk about and people expect in therapy. And that does happen sometimes. But you're right, it's not the majority of what most people experience in therapy. Therapy is coming in, and I call it unpacking boxes. Like literally it's going up to the attic into all this stuff and trying to figure out where the problem is. And that can be tedious and it's a lot of hard work. And then even once you find it, then the next phase is like, okay, how do I work to make a shift or to fix this? And that is the part that it takes investment on outside of therapy, and that is recognizing it and working on it every single day, day in, day out, and recognizing it's not going to be perfect, it's not going to be an overnight change. You're changing habits, right? Thinking habits, behavior habits, and that just takes a lot of consistency and hard work outside of therapy. So therapy, a lot of times what we're doing is trying to figure out where the problems are and maybe what's going on, but then fixing it, a lot of that happens outside of therapy with just constant work on it. You know, we're all work in progress. Like, I don't think any of us are ever going to be there. It's kind of a consistent journey of, you know, I want to be better tomorrow than I am today. And I hope today I was better than I am yesterday. Like, it's just a work in progress. And if you look at that, it's kind of like, it's physical health, right? We don't just work out for a while and all of a sudden we're healthy forever. We have to consistently put in the work, and mental health is the same. You know, it's about recognizing, okay, where are my weaknesses, where are the problem areas, and then doing the work to kind of help work consistently to keep us healthy.
what does it look like to be healthy and balanced in our work?
So I think it's different for everybody, and I think it is different depending on the time of life, right? And I think it changes constantly. That's the key, right? You don't just find yourself like, oh, things are going smooth and in balance right now, and it stays that way. It'd be nice if it did, but the reality is that's something we have to constantly work out. I think all of us should be checking in and just be in tune with ourselves to recognize when things start to feel out of balance. And that can look a lot of different ways too. Like sometimes you just get these small little signals that something's not right. And you're not really sure what it is, so you have to take the time to really check. But balance looks a lot of different ways, and it can look different for different people because some people are very spiritual, some people are very religious, some people are very extremely family oriented, some people are very social and friend oriented, and then work, right? And so there's a lot of those different areas, but I think the key is to find for yourself where you feel the best. And that might seem like a really simple answer, but it's kind of like, where am I functioning the best, where I feel challenged and motivated, but yet not overwhelmed and stunted with like stress. That's the stress continuum, right? And we talk about that sometimes too, but finding that like my relationships are getting enough of me. And, you know, depending on what's going on in your life, those priorities are going to change. Sometimes work is going to take a bigger piece of that pie, and you know, home is going great and we're letting that just go, right? And so I'm trying to get this promotion, or I'm trying to get through graduate school, right? I worked full time and had 2 kids and went to graduate school at the same time. I think I totally didn't give enough to any of those areas. But sometimes it's just about, okay, I just got to get through this and get to this goal, and then I'm going to recalibrate. And that's okay. The focus and the priority can be on different things at different times, but the key is you want to make sure that it's not constantly the same thing. Work can't always be the priority. Otherwise, what's going to suffer? You know, your home life, your relationships, yourself, your wellness. But sometimes work is the priority. Sometimes you're trying to reach that level at work, or you're trying to finish a degree or school or something. Sometimes your marriage is the focus, right? You have to put that effort in, and you have to pull away from work and extracurricular and say, no, we have to focus here. Sometimes you might have something going on in your life, like a kid that's sick, and you're like, wow, everything else is going to stop, and this is going to be the priority, and this is what it needs to be. You're going to get out of balance here and there. The key is to catch it quick and recorrect, right? Like, and just recalibrate and try to bring it back into balance, and not let it always look the same in terms of what the priority is. Has
there been a mentor that's been impactful for you?
I was really fortunate early on in my work career to have some really good mentors that taught me a lot about work-life balance and having work boundaries, and that stuck with me. My very first mentor as a counselor was at Child Protection Services, a local counselor, Gary Miller, who I remember stuff he told me all the time still pops into my head. So you know that obviously he made a great impact if I'm still, 20 years later, remembering some of the stuff that he told me and like living by those words.
A book we haven't mentioned.
Oh, you took the ones.
Did I take them all?
You took the ones that I've been recommending a lot. Well, did we talk about Atomic Habit?
We can throw that one out there.
That one's
we can
another,
edit that out earlier in the
that's another
podcast
habit book that I
Yeah.
really liked that was very impactful.
Well, give me a good beach read or comedy to watch.
Oh, I just read The Fourth Wing. It's a fantasy book about dragons,
fantasy.
which I'm not usually into, but I really like that one.
Do a lot of dragon books with my daughter. She's
Okay.
into it, so
The Fourth Wing is good, but not quite appropriate for your daughter.
Fun workout?
Playing volleyball. I love to play
Nice.
volleyball.
Nice.
Any kind of sport, where you're just running
Team
and
sport,
having,
running around.
Yeah.
Living in Western Colorado, 340 sunny days a year,
Yes.
like getting outside,
It's easy to
going
get
for a
outside.
hike. Yeah, it's
for
amazing.
sure.
And then a good habit you have recently adopted.
Ooh, one of the things that I've really been working hard on, I have 2 teenage daughters, is not to give advice unless I ask.
Unless they ask.
Well, I ask them if they want advice.
I see.
Before I give it to them.
Before you give it out.
So
freely.
ask if that's what, is it okay if I give you an advice, or do you want to know what I think? Otherwise, my role needs to be listening. And that's so hard as a parent. Like, no one tells you that that's going to be really hard, but I think that's something I still am working on. I definitely can get better at, but that's a habit that I'm trying to instill, is just like listening and not advice giving. I'm a therapist, it's my job to give advice, right? But they don't really love that as teenagers, so.
Gotcha. Well, luckily we get a 40-hour class on how to just listen as peer support members.
Right.
So hopefully we can have a little easier time.
Yeah,
with it.
people underestimate how helpful it is to have someone that can just listen to you and not give advice. It's huge.
Nice.
Yeah. The one thing that I tell people is listen to hear instead of listen to respond. We all could take that, a little bit of that.
Listening to hear. Thank you, Jami Lloyd. So good to chat with you.
Yeah,
Appreciate
you're
what you do for our agency and all the agencies in the Valley and surrounding. So great blessing to us. Thank you.
You're welcome. Thanks for having me.
Thanks for joining us on Going Interior. I hope the ideas shared here help you to adapt to the challenges of your life and career. Please share and like this episode if you find it useful. It's been produced by Dirk Klingman and Ellis Thompson of the Grand Junction Fire Department. With special thanks to 970 West Studio for sharing their space, equipment, and expertise. Take care, and please join us again next week.